to the second discussion. And as you probably just heard, the recording is in progress, but I will get to that in a moment. This is our second discussion in our Relentless Together advocacy training series. I hope you were able to join us last week for our federal civics overview. But if not, you can always watch the recording. My colleague Elizabeth Williams will put a link in the chat box shortly. So if you did not get a chance, definitely recommend that. Just a reminder that to please click the chat button, not the Q&A button, to let us know your name and where you're calling in from. And just make sure that the "to" says all panelists and attendees so we can all see it. So with that, we'll get right into it. My name is, for those of you that don't know, is David McGoldrick, and I am the Federal Grassroots Manager for Youre the Cure. As that implies, I manage grassroots campaigns and Youre the Cure engagement at the federal level through work with the United States Congress, obviously Youre the Cure advocates, and related federal agencies like, say, the Food and Drug Administration or the United States Department of Agriculture, et cetera, et cetera. So for those of you that were not on last week, we are celebrating our 40th anniversary of AHA's advocacy efforts, and we thought that it would be a good idea to host a series of trainings for Youre the Cure advocates to give them the information they need to continue being a relentless force for another 40 years to come. Before we get started, as you see on the slide here, a few technology notes. If everyone would ensure their lines are muted and that their cameras are off, that would be ideal. I also want to be sure to mention that this meeting will be recorded and that the recording and all slides and materials will be shared with everyone, every registrant. Closed captioning is also available. All you need to do is click the CC live transcript icon on your screen and you should see them pop up. Another reminder, if you have any questions at any point throughout the webinar, feel free to click the chat button and type your question. Grassroots staff are monitoring the chat box and can help answer any questions or concerns that you have. And we should have time towards the end of this discussion today with our special guests to answer some specific or more nuanced questions that you may have. So that being said, and knowing that your time is valuable, let's jump right into it and talk about what we'll cover today. So I know some of you have been engaging in nutrition policy with us for years, but for those that haven't, we want to start at the beginning and with the basics before moving on to a discussion with our special guest. So during this webinar, you'll learn why Youre the Cure engages in nutrition policy, hear about our federal grassroots priorities for 2021, as well as get an update from Capitol Hill and a quick and easy way that Youre the Cure advocates like you can make a difference. So jumping right into why Youre the Cure engages. Well, frankly, there are a lot of reasons. If you could go to the next slide, please. So frankly, there are a lot of reasons, but perhaps the most important reason is that the link between nutrition and heart health is clear. It's irrefutable, it's clear. So because of that, Youre the Cure has been at the center of the child nutrition discussion for decades and will continue to be a relentless force for a world of longer, healthier lives on this issue for decades to come. So today, millions of children and families rely on schools to meet their nutrition needs. For some, too many in fact, this may actually be their only source of fruits and vegetables in a week. So we need to ensure that we are feeding them enough to thrive. So data has shown that kids today eat too many empty calories. Oftentimes what they eat is laden with unhealthy levels of sodium, added sugars and fats. And I imagine anyone that's been around young children recently can testify to that being true. You certainly see it. You know what they like, unfortunately. Another reason we advocate is that kids today are not getting enough whole grains, fruits, and vegetables, and that this has contributed to the extremely worrisome rise in youth cases of chronic, potentially fatal diseases once associated only with adults. Those include hypertension, high cholesterol, fatty liver disease, type 2 diabetes, and unfortunately, many others. Additionally, research demonstrates that establishing a healthy diet at an early age can lead to a lifetime of good decisions, which can combat this unhealthy trend. Another reason that we advocate, and that I always love to highlight for parents, is that nutritious foods can actually even be linked to better grades. Seriously, that's not a lie. There have been studies over the years that link a healthy diet with improved academic achievement, including better grades and even increased attendance in schools. So lastly, but certainly not the least important reason for why we engage on this, is that frankly, we just all want the best for our kids. Children deserve the best and to be given every chance to reach their full potential. Helping them make good nutrition decisions at a young age can have an incredibly positive impact on the rest of their lives. And that's just something I always like to highlight for folks when we talk about why we're engaging in this. So now now that we know why, we're gonna switch a little bit to what our federal focus is for 2021. Since we know why we engage in the nutrition policy, I just want to go over our priorities, but I just want to note this is not a comprehensive list of all the nutrition work that the Heart Association is doing at the federal, state, or local level, but these are just the areas that we've chosen to focus our federal Youre the Cure efforts on. So if you do have other questions or you want to talk about local or state issues, I absolutely recommend that you join our optional office hours right after this call so you can talk to your local grassroots managers about anything you learned today or anything local, state, etc. Definitely would recommend that. Information will be on a later slide. So getting back to this, group together our work on nutrition, or our federal focus for nutrition, is appropriately named Child Nutrition Reauthorization, or CNR. For some background, CNR authorizes all of the federal school meal and child nutrition programs, including the national school lunch and breakfast programs, which millions of Americans rely on. So although most of these programs are permanently authorized every 5 years or so, and that's an or so because it's been a little while now, Congress must review the laws that govern these programs through what's known as the reauthorization process. So I highlight this because the reauthorization process is where Youre the Cure advocates can really have a say, and really they can make sure that the programs are prioritizing children's health instead of, say, special interests. So as part of child nutrition reauthorization, we have a few issues that we'd like Congress to focus on, and those include strong nutrition standards for school meals and healthy school meals for all. And we'll get to more on this in just a bit. More on healthy school meals for all in just a bit. But focusing on nutrition standards for a moment, we are calling for strong science-based nutrition standards for school meals. These nutrition standards would be without carve-outs for special interests that may be angling for more profits rather than what's actually best for our kids and what's going to help them thrive. So these strong nutrition standards should be used to serve meals that are rich in fruits, vegetables, lean proteins, and whole grains, and low in things like added sugars, sodium, and fats. Additionally, we believe that Congress should provide robust technical assistance to school programs to help them continue to meet or even exceed nutrition standards. So the next area of nutrition policy that we're urging Congress to adopt may be a little unfamiliar to you, so I'll go into it a bit. And that's called Healthy School Meals for All. Healthy School Meals for All would ensure that all children have access to the national school lunch and breakfast programs, regardless of previous eligibility. This policy would ensure that no child falls through the cracks and goes hungry, while at the same time ensuring that all children across the country have access to nutritious meals, going back to the strong nutrition standards, that can combat the rising health issues that we're seeing amongst youth. Another thing to mention is that Healthy School Meals for All could help alleviate bullying or lunch shaming in our cafeterias by removing the stigma associated with the school meal programs. Unfortunately, this is a very, very real issue, and one that I actually remember from my school days, even if that does seem like a lifetime ago now. I can definitely remember it and know that it is still happening. Healthy School Meals for All would also reduce administrative burden and help school systems and food service providers focus on serving kids instead of balancing, say, complicated budget systems or filling out paperwork. Allowing for Healthy School Meals for All would really give them the time they need to focus on serving those nutritious meals to as many students as possible. Additionally, the COVID-19 pandemic and the struggle that schools are facing to continue to serve in whatever capacity they can has really demonstrated just how much we need to adopt Healthy School Meals for All, as it's really highlighted that there are millions of families in this country that are on the edge of eligibility for the school meal program, and that their eligibility can and does in fact fluctuate throughout the year, which would impact their ability to feed their kids. This is just another example of why we need Healthy School Meals for All, so that to ensure that no child does fall through the cracks. So now that we've kind of gone over some background and what policies we're going to be focusing on, I think it's probably time to move our discussion to our special guest. Next slide. Yeah, thank you. So some of you may have met her at previous federal lobby days or even visits to the Hill on your own for special things. But if not, allow me to introduce Christy Anderson. Christy is our Senior Government Relations Advisor and primarily handles what we call our prevention portfolio. So that portfolio includes things like nutrition policy, obviously, but also things like active transportation programs and so many more things that have direct impact on our lives and our ability to be healthy. So for a little background, Christy joined the Heart Association around 10 years ago after starting her career working on Capitol Hill for former Senator Tom Harkin. She is a true expert on this issue and a champion for child nutrition. So Christy, thanks so much for joining us and welcome.
Yeah, thank you for having me, Dave. And hello all, it's an honor to be here with you today.
All right, so let's just jump right into it. Christy, as you've heard, we've talked a good deal about child nutrition reauthorization today, but so I was hoping you might be able to give us an update on where that stands on Capitol Hill.
It's a good question, and I'll caveat my remarks by saying this is where it stands today, but the Hill is ever shifting right now. So who knows, tomorrow the intel might be a little different. So the last time child nutrition reauthorization was reauthorized was in 2010. So it's long overdue for a reauthorization. It is in the jurisdiction of the Senate Agriculture Committee and in the House, the Education and Labor Committee. And the chairs and ranking members of all the committees have said they want to get a child nutrition reauthorization done this year. However, COVID happened. We have a new administration with priorities around recovery and the infrastructure bill that just passed a couple weeks ago. President Biden also wants to do what he's calling the families plan. So our Hill staff that are in charge of writing the bill, a little bit distracted right now, trying to meet all those other deadlines that are given to them by their leadership. Now, they keep saying they want to do it. There's also something happening called budget reconciliation happening right now, which is highly wonky, highly complicated, but I'll just say that budget reconciliation could be an opportunity to get healthy school meals for all. So we're kind of running down two train tracks right now, child nutrition reauthorization and budget reconciliation. Our Hill friends have said once budget reconciliation is done, they're going to turn immediately to child nutrition reauthorization and try to get it done by the end of this calendar year or maybe very early next year.
Thanks, Christy, for that. That's really helpful. And just since you mentioned reconciliation, want to flag that that was something we did go over last week in our civics overview. So hopefully for those of you that were here last week, this is not new. And as you can tell, it's a really important issue that really will impact quite a bit of our priorities going forward. So, Christy, moving on a little bit, in recent years, we've had to play defense to block harmful policies or amendments that would impact child nutrition. As the current Congress is considering CNR, do you see AHA and Youre the Cure advocates as needing to continue to defend against policies that would hurt children, or is it finally time to play offense and really improve nutrition policy?
Good question. So I think we definitely are in a position to play a lot of offense right now, but we can't give up on our defense. An example I want to give most recently in the agriculture appropriations bills, where funding for these programs come. In the Senate bill, there's what we call a right, something that changes policy that has nothing to do with money. But there is a rider in it that would prohibit the sodium targets in school meals. The sodium targets are, the sodium is decreased in 3 different levels to give schools time to adapt, to give industry time to adapt, to give kids time to adapt, right? But this rider says that USDA would not be able to decrease the sodium beyond target 1 where they are right now. And there are 3 targets. Which is really unfortunate because the science is very clear about the connection between high sodium intake and children's risk of developing hypertension and heart disease. And the sodium targets just get the kids their meals down to the uppermost level of what's considered safe and healthy levels of sodium. Now, on the flip side, in the House Agriculture Appropriations Bill, there is money that AHA got in there to help USDA give technical assistance for sodium reduction. So this is a prime example of right hand not knowing what the left hand is doing and not coordinating. So that defense going into conference for appropriations, going into child nutrition, because there are those that will try in the child nutrition reauthorization bill to weaken the nutrition standards, that defense is still very, very much needed.
So it sounds like it's a both yes to offense and to defense, and that we really need to be aware of and take advantage of any opportunities we have to make our voices heard.
Absolutely.
All right, got it. Okay, so I know that moving on to the next one. I know we've focused primarily on CNR today, but that is, as you've even mentioned already, that is not the only nutrition policy that you're working on at the federal level. It's just what we're focusing on for Youre the Cure advocates. Are there any other nutrition policies that the AHA and you are working on that you might want to highlight?
How much time do we have?
How about 3 minutes? How about 5?
Do we have 3 days to go over my portfolio? I'm joking, but yes, in addition to child nutrition reauthorization, and I'll say with child nutrition reauthorization, it goes beyond just this bill. It also goes to working with the US Department of Agriculture, USDA, because they'll be in charge of the rulemaking process. What happens is Congress passes a law, then the appropriate agency puts out guidance or puts out rulemaking, and with rulemaking, they solicit feedback from stakeholders. So we already know that USDA is planning on updating the child nutrition standards. They are allowed to by law. They're actually supposed to do it every 5 years when the Dietary Guidelines for Americans comes out. And the last DGA just came out last year. So that is something that's on their agenda for the fall, is to update that. So we'll be working with USDA. I mentioned the DGAs, even though I said they only come out every 5 years, that process takes a full 5 years. So we're already looking at 2025 DGAs working on that. Working with the Food and Drug Administration on voluntary sodium targets. And this is mostly my colleague Susan, who handles our regulatory work. But not only the voluntary sodium targets for industry, but definition of healthy, a bunch of other sort of things that the Food and Drug Administration has jurisdiction over. And then starting next year, we're going to be working on the Farm Bill, which, like CNR, is a authorization bill that happens every 5 years. The last one was in 2018. So technically it doesn't expire until, I'm doing the math in my head, 2023, but we start that process very early. Unlike child nutrition reauthorization, the Farm Bill is what we call a do or die bill. They have to pass it, otherwise funding stops flowing to states, stops flowing to farmers, stops flowing to localities. So this is something where if we don't get child nutrition done this year or very, very early next year, it's not going to happen, because they're going to have to turn their focus, the Senate Agriculture Committee, their focus on the Farm Bill. Now, currently, AHA, we go through a process of a literature review, go through the science to set what our policy priorities will be for various bills. We're doing that process right now for the Farm Bill. But some of the things I know we'll be working on is strengthening SNAP, strengthening diet quality, probably looking at the policies on the nutrient substance of crops grown. So I'm really excited going into this next Farm Bill on what we'll be working on. And then, of course, just happened this week is USDA updated what's called the Thrifty Food Plan. It's an algorithm on which SNAP benefits are based on the economy, based on the market, based on various other data on what the American diet should look like to stay healthy. And that was just updated on Monday, and that's something that we have been working on at AHA since the 2018 Farm Bill.
Got it. Thanks. And, for some of our longtime advocates, you might remember the work that we did with grassroots around the last Farm Bill. You really did make your voices heard. There were thousands of legislator contacts. Thanks so much for your help with that. And I guess get prepared to start on that again over the next year or so. So Christy, I really appreciate your time and the information. It's super helpful and really gives us an understanding of why we're doing this and and all of that. But going back to CNR for just a second, is there anything that You're the Cure advocates can do that might reinforce your efforts on the Hill and make your job a little easier? Like maybe, for example, a quick action that they could take literally right now. Next slide, please.
Yeah, way to cue it up, Dave. Yes. So we do have an ongoing action alert right now to Congress asking them to make nutrition standards and healthy school meals for all a priority going into child nutrition reauthorization. But we're also launching right now for you all a call to action to the Senate asking to ensure that healthy school meals for all is a priority, not just for CNR, but budget reconciliation. And don't worry, we're not going to make you explain budget reconciliation when you make the call, because again, that's very, very wonky. But that is really our best opportunity right now to ensure that every kid can get a healthy meal at school is through this budget reconciliation process. So you can see here, Dave has the call to action up here, text lunches to 46839. Sorry if I stole your thunder, Dave, and you were going to read that.
No, I mean, thanks for doing it. But yeah, just as Christy mentioned, you can take action on this campaign by texting lunches right now. It's quick and easy. You can actually, you'll be sent a link. You just type in your info and a message will go to your US representative and both senators in as little as 30 seconds. So I'll give you all just a minute to take that action before moving on.
Dave, while everybody is taking that action, we do have one question that's come in that I think Christy might be able to answer for us. And Christy, we have the question, how can we ensure that the child nutrition reauthorization is not just a box checking exercise for the legislators? How can we make sure this is going to be meaningful?
Yeah, that's a great question. And Sandra, I'm glad I pretty much answered the question already, but I'll also add too that that is also a concern of mine, right? Because we have a very unique opportunity right now coming out of the pandemic to really innovate child nutrition programs, and not just school lunch and school breakfast, but WIC, the fresh fruit and vegetable program. I mean, as Dave said earlier, the pandemic has really highlighted where our gaps are, where our weaknesses are, and there is this feeling among the community that we can all come together and really be meaningful. And I always say, nobody particularly in child nutrition reauthorization, because whether they have a reauthorization or not. So, you know, to get back to your point, Sandra, it's, you know, keep putting pressures on your senators and your House members. I can't tell you the number of times I go into an office and say, well, we haven't heard from anybody on that issue. And in the back of my mind, I'm like, well, yeah, you have, because I know our Youre the Cure network is awesome and that they've been calling. But as someone who used to be a staff assistant on the Hill and the one answering all those, you pay attention when you hear about a certain issue a lot, and then you bring it to your member, and they do pay attention to what their constituents are saying.
See, You're the Cure advocates do make a big difference. You heard it here first, folks. Betsy, did we have any other questions that Christy can answer, or should we be moving on?
Not that I have seen in the chat box, but I will definitely prompt you if something comes in. Thanks, guys.
Okay, well, unless we get any more questions, that almost concludes things for today, but I do have a few reminders for you. The first is that this is a series, and we will have our third installment next Tuesday at 1:30 Eastern. The topic, as you can see, is Achieving the Tobacco Endgame, and we'll talk about how the Heart Association You're the Cure advocates are working to curb the vaping epidemic and are empowering youth to be the voice for change. We'll have several expert guests next week, and I hope you will all join in. So I'll close things with one final thank you to Christy for all of your help and information today. We really appreciate that, as well as a reminder that we do have optional office hours that will be immediately following this webinar. So if you have any questions, want to chat about what you heard today, or you just want to meet your local grassroots managers, make sure to join. Links are being put in the chat box right now. with specific states for which link to join, as well as you can also refer to the map on your screen. So, you know, for example, if you're in Maine, join the Eastern States call. If you're in Texas, join the Southwest, and so on. The links, as I said, should be in the chat box or in your confirmation email. So want to close this with,
Dave, sorry, there's one more question in the chat box that just came through, if you don't mind for me to answer.
Go ahead.
The question is USDA who determines the school lunch, breakfast, nutrition standards? The short answer is yes. There's a sub-agency called Food and Nutrition Services. And what they do is they have to base it on the dietary guidelines for Americans. And they take the dietary guidelines, they interpret it, what it means for school meals, for school lunch, for school breakfast, for the child and adult care food program, for special supplemental dinners. And then they do what's called a regulatory process where they call for comments from stakeholders and experts. And so they hold the comment period. AHA has always provided comments, and in fact, in some final rules, we're often quoted as in their final rules justification of why they're taking why they're going in a certain direction for a nutrition standard. So we'll see that again this fall, since USDA has committed and put it on their fall schedule that they will be updating. And then if we get a child nutrition bill through, which fingers crossed, we'll have another process of regulatory comment period and rulemaking.
Thanks, Christy. And so I guess we'll do one final call for questions since we do have a few minutes. If there are no more questions, though, I just want to say thank you all for joining us today, for all that you do for Youre the Cure. As we've heard, both last week and this week, your voices really do matter, and your efforts allow us to be as successful as we are as an organization. We really couldn't do it without you, so thank you, and I look forward to seeing you all next week. So have a great day, everyone, and don't forget, the optional office hours are immediately after this. Thanks, everyone.
Thank you all.